Hello, everybody. Babies cry a lot. Sometimes they don't cry, but scream. Today, we are going to talk about the most frequent reason for their screaming. Baby colic is the subject of today's program. Let's find out. Hello, my dear friends. Today we are going to talk about baby colic. Luisa, you are a young grandmother. Have you ever come across baby colic? Yes, I have. You know, I think that all babies have colic regardless of their age. In fact, Luisa, according to medical science, 30% of children have colic. That is what medical science says. Let's find out what our experts think about it. If they have fat bellies, mommies know what pricked their bellies. Mama put him under the light today. He kept crying. And then she put him on the sofa. We have a sofa at home and my brother stopped crying. Well, it may have been bad milk or the brand. Or maybe they may have fed something wrong or overfed. They won't calm down. Belly hurts if the baby's sick or wants to poo. Because of gases. I don't know that. I'm not a doctor. Maybe they're missing the mommy. You know, one of our experts who frankly answered that she didn't know because she wasn't a doctor is wrong too. It turns out, and you will be surprised, that mankind has been dealing with the baby colic for as long as it exists. And even the most intelligent specialists do not know what exactly causes colic. Nevertheless, doctors do know what can cause infant colic. People very often come to a doctor and start complaining about colic. Anatoliy Anatolievich, his wife and daughter came to see you. Absolutely right. Let's see what we've been talking about. Under his belt, Anatoliy Anatolievich is his patronymic, has a captainship NKFN team Krivoy Rog, work at entertainment programs, the Victory and comic program. In short, he's an expert in humor, and he knows firsthand what it means to laugh to colic. The situation becomes even worse with infant colic because the daughter of Anatoliy Anatolievich, Alice, has turned 6 months old. She is his firstborn. Colic caused inconvenience to Alice for quite a while. Even more, it caused anxiety to Mama Julia and, of course, Anatoliy Anatolievich. Help, doctor, help. They turned to Dr. Komarovskiy. This is very important. Colic is not so much a baby problem, but a family problem. Especially in our country where we need to do something. And we did. Of course you did. Do you think there's anybody who would do nothing in this case? Just imagine a baby lying and screaming while you're doing nothing. You're just like an evil stepmother then. So what did you do? Help. You helped. We purchased medicine for gas and found a bottle. Great, you know. No, I don't. Bottle for gas. Maybe a special nipple for babies. Exactly. One that helps reduce gas. It really works. It does. By the way, keep in mind, nobody can still tell what causes colic. Here's a seemingly unique situation we have a problem that in the best case scenario, if we are lucky, 40% of babies suffer from. How interesting. Of course it's interesting. She's intrigued too. A man with a mustache, everybody's talking. Of course it's interesting. So imagine there's a great medical science about several thousand years old, and all of a sudden it faces a phenomenon occurring in 40% of cases with babies at the very least. It means that there are babies who don't suffer from colic. Of course, I, for example, am a happy father of 2 children who have never had colics. Well, you're a doctor. Indeed, but I don't know what has helped me there. It means medical science is only trying to explain it. But is not convinced here, not convinced as to why babies scream. Yes, it's believed that during breastfeeding, the baby is sure to swallow some air. And this air, when their intestine contracts, makes the baby feel pain and therefore scream. And indeed, if we change the sucking technique, colic intensity decreases. Yes. And you come up with this on your own. And I don't remember, either someone advised me or we just found out about it on the internet and we looked for a fancy bottle and ordered it, yes. On the internet, it was delivered, maybe a mere placebo effect. But we believed that the baby bottle would help me. And again, remind us, how old was your child when you brought her that desirable bottle? Well, she was almost 3 months old. Splendid. Note, medical science claims that colic normally disappears by the age of 3 months. Oh. But you're lucky to have found the baby bottle before the age of 3 months. Well, yes, it is as if they disappeared on their own. Well, we would say that the bottle helped. Unfortunately, that is how it is. Nevertheless, if all the guides and aids say no medicine, no baby bottles will help, how much less will the state get in taxes from the manufacturers of these baby bottles and the medicines? In fact, nobody is interested in us buying nothing, except for us who pay for this. However, it's great that you didn't try anything really dangerous to fight this colic. That is giving your baby absolutely, I repeat, absolutely safe medicines that reduce aerogenesis in the intestine. I hear it. It is these you gave. You could even give them not 3, but 33 times a day. And it wouldn't do any harm, though it wouldn't help either. However, this medicine is absolutely safe, and your baby wouldn't feel unwell from you changing not 1, but 10 bottles. Yes, Poppy would have to go and give another concert to pay for these bottles, but it wouldn't hurt anyone. And Mom wouldn't see Dad that evening, but no one would be hurt. However, there are many other methods when babies are given a lot of pills and injections, when they undergo a lot of examinations with tubes inserted in the baby and a lot of examinations conducted. Yet, nothing will help. You were smart enough not to do any of that. Thank you very much. What else did you do? Tell us. You know, I worked hard on myself because they claim I was breastfeeding till 4 months. Yes. And they claim that enzymes in breast milk can cause colic too. So I tortured myself. Tortured. Yeah, I tortured myself in terms of nutrition, diets, and so on. But still nothing helped, did it? I don't know. Being a henpecked husband, I agree with everything she does. Oh, my dear, I'm warning you. You can't speak like that in front of Dr. Komarovskiy. It drives me mad. Do you understand? I'm getting mad, honestly. I think we'll survive that somehow. Under no circumstances. We are trying to influence all the men in our country on your example. Let's do it. I'm ready. Here, look. You've come up to the topic. Colic. Colic and women. Your women. Who kept fighting with herself, adjusting her diet, biting now, then not eating. She used you, her henpecked husband, to run errands, buy that medicine. I was advised that bottle, but nowhere to be found, indeed. But nothing helped. It couldn't help, because it's time and patience that help only. That is the only thing that really works. Nothing else helps. But you relied on the following. What is the biggest problem of a Ukrainian father? He believes himself a 0. when it comes to children. So you believe you have an expert at home, and your business is to be henpecked husband. Well, there are also grandmothers. Exactly. No, you didn't say two grandfathers. You mentioned grandmothers. Men in our country have nothing to do with their children in principle and don't want to. As a result, children and women take a lot of medicines only because they are scared and they feel like they have nothing to do. They need to do something. And our father believes that his love for his child is about going to the pharmacy and buying a lot of medicine. You see that, don't you? Well, you see, Father, you're nobody. You have her, two grandmothers. Let them deal with the problems, and I will go do the concert. Make some money for a baby bottle and medicine, and you can do whatever you want to. You've come across a problem. Let me tell you. Totally. It's a safe one that disappears on its own. But similarly, when your baby gets a cough and have a temperature of 39 degrees, grannies will come running with vinegar to rub the baby with. And you don't know yet if it's good or bad for your child. And I want you to learn it. I want you to understand that your child's life and safety are defined not by granny's advice, but on what their fathers know. Is it clear? And who is it makes these important decisions? Fathers. Fathers. I was just about to say that. Say it, Tolka. Say it. Where am I to look? What camera? Look at me. At me. Dear Dr. Komarovskiy, I believe that it is fathers who must take all important decisions. And what is a mother's role in such situations? Obeying fathers. Placing fathers in a situation where they'll have to make a decision on their knees. Here he comes after work. And you tell him, darling, we are 6 months old. What do you think we should start the complementary feeding with? Grandma on your side believes it's best to give semolina. And Grandma on my side says it's best to give beef rolls. But I personally think that I shouldn't bother much. I'd rather go and buy some instant oats to give the baby. But it's up to you to decide. But you as a man won't make a decision just like that. You will surf the internet, seek out books, read how complementary feeding is done in the 21st century, don't you? Because your grandmothers, judging by your age, gave you complementary feeding in the 20th century. Well, yes. Since then, a lot of things have changed. Both in nutrition technology and consuming capacity, a lot has changed. That's why you need to find another mechanism for decision-making. For example, what is the most terrible thing about colic? Is that colic is one of the most frequent reasons for the family breakdown. Well, you have two grandmothers, which must save you. Because when a baby is constantly screaming, what does a typical mother do? She carries her child in her arms all day long. And after she's been carrying the baby in her arms all day long, father comes home from work to see, imagine what? He sees something he wants to run away from as far as possible. God, we didn't have that. Great. That means we're smart enough. We had... Yes, and how was it in your case? We had colic right on schedule at 8 o'clock, 8 p.m. By the way, what's the cause of that? Every day we sat and waited, counting minutes. I fed the baby at about 10, 15 minutes to 8, and 8 o'clock it all started. Indeed, I can confirm this. This is how it was. You see, medical science suggests, note suggests, rather than claims, that is connected with the daily changes in the breast milk composition. That in the evening, it contains a little different amount of hormones and a little different fat content. So everything fits. I want to point out again, it is a suggestion. But if any mother who is watching us right now can draw conclusions that if her baby smiles or sleeps all day, everything is good, a kind and smiling baby, and all of a sudden the baby starts screaming. Moreover, it won't stop, no matter what you do. And then suddenly, as if on cue, it stops screaming and starts smiling again. That is what colic is. The main thing you need to understand is that colic is not so bad. All you need to do is have patience. Because your mothers were patient and raised you, and you must be patient. Because screaming, even baby screaming, is a bad advisor in decision-making. Now turn her head closer to me, closer. Now we will show the way you massage her belly was inconvenient.
теперь руку своей, основанием ладони
Now
ставим
place your hand below her neck,
на лобу.
the other one on the pubis,
И
and start massaging clockwise
пальчиками.
with the tips of your fingers.
Вот, нет, вот
Like that.
держи.
No, look like that.
Сейчас мы такой.
Hold her. Place it like that. And see? Let's do it again.
Поворачиваем.
Let's turn.
Замечательно. И так приятно
Splendid.
дрыгать.
What a pleasure to kick your legs with dear daddy.
Скажи, вот,
Why scream?
да. Вот когда ты встретишь мужчину, который так замечательно.
When you meet a man who will massage your belly well, you'll be happy.
Все так хотят.
Everyone wants Komarovskiy to massage them. I advise you, Colic, first to practice on your wife.
Кричать она не будет.
She won't scream, believe me.
Мы сейчас подумаем о втором.
Now we are thinking about a second child.
Уже пора, поэтому
Then you need to master the belly massaging technique.
вот, и в процессе тренировки на
While
маме.
training belly massage, you will be able to make a boy.
Это обычно
Generally, this is how belly massage to a wife ends.
Главное,
The main thing,
вы уже поняли.
I hope you've already understood,
Это
infant colic is temporary and not serious.
не болезнь.
It is not a disease. Nevertheless, I'm sure you have a lot of questions. Let's start answering them. Me first.
Да, Луиза,
Yes, Louisa. What is colic? Let me get this right. It is just a
на
bellyache?
самом деле колики,
Well,
вот вообще
how does medical science define the word colic?
слово колики, да, это приступы.
It is an episode of intense pain.
Боли, приступы
The
короткие,
episodes are short,
повторяющиеся.
but they go on one after another. In fact,
Поэтому колики
there are different types of colic.
разные. Бывают
For example,
печёночные,
biliary colic.
когда
Biliary tracts are obstructed with liver stones,
или почечная
or renal colic,
связано с
because by
прохождением
kidney stones flowing through the renal duct.
в почках.
There is intestinal colic caused by the passing of fecal bolus.
А бывают колики младенчиков.
There is infant colic whose cause is unknown.
Вот вы
See?
понимаете? И тут что
And what is the most important about it?
что вот этот диагноз, колик, диагноз,
Colic is a medical diagnosis.
его
Mother
нельзя
cannot
понимать
set it.
на самом деле. Это диагноз медицинский. Но вот тут есть такое понятие. Это диагноз исключения.
This diagnosis is an exception. What does it mean?
Что когда ребенок не
It means that when a baby starts screaming for no reason,
то нужен врач,
you need a doctor to understand why he or she is crying.
чего он орет. Если у
If your baby has a red butt
красная задница,
because you have overheated it,
перегрели,
there is intrigo.
и он орет, то это не
That's why the baby is screaming, not because of colic.
родителей.
That is just mindless parents. Do
Если
you understand?
температура и отит,
High fever, otitis, earache,
он объелся и не какал,
no pooping for 5 days. It's not colic,
это реальная
but an actual illness
которой доктор
for which a doctor can help with medicine.
Но если ребенок
But if the child is lively, has sound sleep, no skin problems, gains weight, good appetite, no ear or throat problems, everything is just perfect. When suddenly
часа в день он как
she starts screaming for 3 hours a day without calming down and with nothing comforting her, it is colic.
Они у нормального
Normal kids
врач
who are diagnosed with nothing have them come and go as if on cue, after which they smile again.
Удивительно.
By the way, colic has another interesting peculiarity.
Вот когда пытаются
When people try to analyze this cry with certain equipment, let's say to make an audiogram,
делают, допустим, да, то сама
they find out that this cry is special, different.
какой-то не такой. Вот плач при коликах имеет какие-то свои.
Colic cry has its own individual characteristics.
Оказывается, вот именно колик.
It turns out that the colic cry, in some strange way, has an effect on the female psyche.
Невменяемая. Она
In other words, mothers become absolutely insane,
сыны. Самая большая
ready to do anything. And as for medicine, the worst thing about colic is that women can face it
может столкнуться с
when in the state of postpartum depression,
депрессией. Когда она совершенно
when they simply cannot adequately react to the cry.
нестандартно, понимаете? И даже навредить себе.
They can even harm themselves and the baby, see?
Поэтому всегда надо.
When the child is colicky, the father's task is always to make sure that his woman is okay and can be left alone on her own with the baby. Is it clear?
Приняли информацию к размышлению?
One more thing, doctor. There is an opinion that baby boys have colic more often than baby girls. Well, your children are an exception. Indeed they are. You know, Louisa,
Вот вижу в
I rarely encounter it in medical literature, serious literature.
вот в американской, например,
American, for example, they do not distinguish it by gender.
однозначно вижу,
My practice shows that boys scream more often than girls.
чем у девочек.
Their colic passes later and lasts longer.
Значит, родителям мальчикам надо...
So it means that a boy's parents must need a lot more patience?
Надо больше терпеть.
Certainly. Generally, you need a lot more patience with boys.
Доброе утро, доктор. Скажите, пожалуйста.
Dr. Komarovskiy, good morning. Doctor, if I understand you right, no medicine can help and there's no point in giving any.
Вообще никакие.
None.
Маме очень
To the baby, none.
Потому что
But a lot to her mommy.
что-то делать.
Something should really be done.
Поэтому вы вот четко
You must understand
понимаете,
quite clearly, if you decide to do something, well, if your grandmother advises you to give dill water,
дать ребенку
or you hear on TV about pills to neutralize gases,
для того, чтобы вы услышали,
and your baby feels better and better,
лекарства, которые
use it in good health.
и ребенку от этого становится лучше. Вот это абсолютно безвредно.
They're absolutely harmless remedies, absolutely.
Например, к примеру, лекарство.
Let's take, for example, the drug with chemical name simethicone.
Это химическое вещество.
This chemical agent reduces the formation of gas in the intestine. In what way?
Уменьшает
It increases surface tension of gas bubbles.
газа. И газы как бы
So, simethicone doesn't react with the organism itself. They are gases. They are in the intestine and they cause less tension to the intestinal wall.
Давит на стенки кишечника.
No gas. As easily as this drug comes in, it goes out.
А можно, как я сказал,
I mean, you may give it 3 times a day or 33.
это просто дороже.
33 times a day is a lot more expensive.
Вопрос в том,
Another question is,
как механизм
what the effect is kind of
понятен.
clear.
Но если мы берем 100 детей,
But if we take 100 babies, give them a medicine for gas, and then take another 100 children and give simple water, the result will be the same in both cases. Is that clear?
все ваши подруги дают.
However, if we give water, you'll feel like an evil stepmother, because all your friends give expensive medicines for gas. For that reason, you better give the latter to feel better.
Моя мама...
I have another question.
Что вот...
My mom says that back in the time when I was little, there was no colic problem at all. And now everyone has colic. Why is that so?
С чем это связано?
Вы знаете, вообще особенность советской медицины...
You know, there is a peculiarity about Soviet medicine. And I assure you, in our country, the doctor would not say, I don't know.
Слово «я не знаю». Вот вы понимаете?
Do you understand?
Если врач сказал «я не
If a doctor said, I don't know, he was not a Soviet
это не
doctor.
советский врач.
A Soviet doctor always knew the answer to any question.
Ответы на вопросы. То есть, я
Soviet science knew the answer to any question.
изучать вот импортные...
So when I got an opportunity to study foreign textbooks, British, American, and European, I was astonished to frequently find there, we don't know why.
Знаем от чего. Вот мы не знаем, от чего колики.
We don't know why colic happens.
Советской власти, когда вы...
Under the Soviet regime, when you were a child,
не мог написать...
a Soviet doctor couldn't simply write down the word colic,
Он писал...
caused by God knows what. He diagnosed a disease, something like dysbacteriosis or biliary dyskinesia.
Нормальный диагноз.
So you have a diagnosis but never colic.
Могло быть колик в принципе.
You couldn't have colic at all,
Не были.
although the rest of the world had it.
Здравствуйте.
Hello, Dr. Komarovskiy.
Вот такое мнение.
What can you say about the following? When a baby is born, his or her bile ducts and intestines are still immature, which causes colic. Is that true?
Действительно,
This is merely a hypothesis.
гипотез.
And when we say that we don't know for sure, of course it doesn't mean we have no theories.
Конечно, и вовсе не говорим о том, что у нас нет никаких версий. Да, есть версия о том, что...
There's another theory about immaturity of intestine nerve endings, which causes pain concentrated in the intestines, resulting in colic.
Более локализуется именно в кишечнике. Почему? Потому что
Why?
возникает
Because this has something to do with digestion.
с процессом пищеварения. Поели,
As soon as you eat, colic starts. That is after the meal.
питание. И очень часто, особенно
We can often observe a pattern among bottle-fed babies.
смесь и выраженность.
When we change the infant formula, the colic intensity decreases.
И уверены в том, что причина этой боли...
We are sure that this is what causes pain. Its source is in the intestines. We don't know for sure how to influence that. But we do know one thing. We've already talked about that. There are two important factors that dramatically increase colic probability and intensity.
Их выраженность.
The first factor is overfeeding.
Перекорм, и второй фактор называется перегрев.
The other is overheating.
Опять-таки,
Overheating and overeating,
перегретый, он
infants can scream, but not only because of
у
belly aches.
него просто добавляется еще куча.
There are a lot more causes that intensify the colic.
Тем не менее, вот я почему-то,
Nevertheless,
когда
in American literature,
в американском
I came across a statement that only 30% of infants have colic.
что колики имеют место у 30%.
I completely disagree with that.
Я с этим не согласен категорически, потому что по
my mind,
по моей
And according to my mailbox, in our country, 70 to 90% of infants have colic.
детей. Ну вот, я вам приведу
I want to cite one thing from an American pediatric book. I want you to think
в
about it.
возрасте 6 месяцев
By 6 months, 90% of babies sleep without waking up from 12 a.m. to 6 a.m.
До 6 утра. Ну кто в нашей стране
Who in our country can believe this?
верить в эту цифру?
Who?
Никто. Тем не менее,
Nevertheless, when I analyze my patients who follow the initial recommendations of not breastfeeding every half an hour,
не прикладывают
walking,
каждые 3 минуты,
bathing correctly,
гуляют,
moisturizing and airing the rooms,
меняют, проветривают, то я согласен с
I agree that more than 90% of children sleep very differently.
спят совсем иначе.
They sleep well and have well-slept moms who are loved by their daddies and very much.
Понимаете? Поэтому я хочу,
Do I make myself clear?
что вы
That's why I want you to understand that to raise a child and have no serious problems and sleep well at night, it is an absolute real task.
Только надо пересмотреть свои
You just need to reconsider your views on upbringing and childcare processes.
Надо понять, что наши
You need to understand that your grandmother spent sleepless nights not because we were bad,
не потому, что мы были плохие.
but because they didn't always know how to do it right.
Всегда знали, как надо.
Here, right now,
Если мы вам сейчас
we are telling you how to do it right,
у вас более
and you have a lot more chances for happy motherhood.
все это реализовать.
If not with the first child, then perhaps with the second one.
Со вторым.
Thank you, doctor.
Доброе утро, доктор.
Good morning, doctor.
Бывают ли колики у взрослых
Does
детей?
colic happen to older children?
Ну, бывают, но это тогда колики
do,
уже либо печёные,
But in this case, they're either biliary, intestinal, or renal colic.
Колик младенческих не бывает. Они бывают.
They are not infant colic, which happens to infants only.
Колик состоит в том, что, как правило,
This
они
peculiarity of infant colic is what it usually starts in the third week
и
and ends approximately by the age of 3 months.
месяцем. Ну, у большинства
For the majority of infants by the age of 4 months.
всех к 6.
And the rest
Вот
by
эта
6.
цифра 3. Она такая волшебная.
This figure 3
Она как
is
бы
kind of a magical in terms of colic.
начинаются в 3
It somehow describes the general tendency. It starts at the age of 3 weeks,
около 3 часов.
lasts for 3 months,
Примерно
for 3 hours a day, 3 times a week,
примерно
or
3
3 consecutive weeks.
То есть вот эта цифра 3, она
This figure is common for colic.
после 3 месяцев
At the age of 3 months, a colic, as a rule, disappears or becomes less intensive.
Подскажите еще, пожалуйста,
Hello, what would you advise?
ребенку
Everyone advises to use catheters to help babies get rid of excess gas.
насколько это вредно? Вот мне кажется,
But I think it's very dangerous.
это очень вредно. Ну, то есть
Ну, вы понимаете, на
Frankly
самом деле,
speaking,
я,
expecting a question about catheters to come up, I sent my people to a pharmacy here in Kiev and asked to buy a baby catheter for gas release.
трубочку для ребенка. Вот дали вот такое.
And they brought this.
Вот, видите? Вот это вот газоотводная трубочка.
This is a catheter for gas release.
Трубочкой.
This tube in the hands of a mindless father or mother can poke through the baby's intestines.
Понимаете, да? Поэтому, когда
Got it.
любой
That is why when surgeons come across a problem, they do, and they see a baby with a tube in the bottom,
когда привозят детей,
they're about to shout.
втыкали в задницу,
throw it away and forget about catheters for gas release.
кричать: да уберите вообще слово, забудьте такое газоотводная трубка. Нет, понятно, что есть...
It's quite clear that in civilized countries, there are catheters which are impossible to insert too far.
Понимаете, они примерно вот так вот выглядят, они из мяса.
They look something like this. They're made of soft plastic and so on.
Что мама
But that is not the
должна
question.
четко понимать, что если все-таки мы
Mother must understand that if she inserts such a catheter,
то делать она надо после того.
she does it only after massage,
Когда мы
which has made sure that there are gases.
Опять-таки, если мы поставили эту
And
газоотводную
again,
трубочку, и через...
if you inserted a catheter and 10 minutes later your baby's still crying,
так давайте перестанем это делать.
stop doing it because it's inefficient.
В конце концов, от чего у ребенка...
A baby can have excess gas in the intestines
Образование в кишечнике.
because she's eaten more food than she can digest.
Образование возникает тогда, когда ребенок
So she digested 90% and there were not enough enzymes for 10% of the food.
чем может переварить. То есть он съел
And this undigested food undergoes what? Process of decay.
ферментов.
As a result, gases are produced, and the baby is crying.
Подвергается чему?
What does a Soviet mother do when baby is crying?
Газики. Из-за
She
газиков
feeds
ребенок
him.
орет.
She keeps on feeding her baby because if she is screaming, she is hungry.
Она его кормит.
Normally, if a baby is steadily gaining weight,
То есть по-нормальному...
you can try to increase intervals between feeding. Is that clear?
Перебирает еще. А у него болит живот, так что надо
It's better to give her some water.
увеличить интервалами.
Massage baby's belly, reduce time for breastfeeding, which means reduce the amount of food eaten
Уменьшить время нахождения.
at a breastfeeding session.
Сократить, уменьшить объем.
However, we must have a very modern theory of feeding on
Есть
demand.
очень модная методика.
When babies are breastfed 20 times in a 24-hour period,
Раз в день по первому писку.
as a result, they scream throughout the 8-9 months, but everybody's happy. She does her maternal duty.
Выполняют свой материнский долг.
Hello, doctor. Could you please tell me if the diet for breastfeeding mothers affects baby colic?
Сразу говорю, абсолютно никак.
I will tell you that once,
Вот не
no, it
влияет
doesn't.
совершенно. Вот не надо над собой.
The mother can have a normal diet and enjoy her
Мама
food.
должна
Is
питаться
it clear?
нормально и получать от еды удовольствие.
In fact,
Все вообще.
what really
что
always
действительно
influences the baby is his or her mother's well-being, her mood.
Это, по большому счету, мамы на самочувствие, мамы на настроение. Если мама...
If she doesn't have enough sleep, if she quarrels with her husband, if something hurts, so if she really doesn't feel well, or if she sleeps badly and quarrels, plus when she sees a plate with potatoes she wants to eat but she can't, she just loses the meaning of life.
Ребенок это вообще конец.
And a crying baby is the end of the world, so it leads to inadequate decisions. For that reason, the father's task is to calm down and feed the mother, get her to bed, and when the baby is colicky, to send his wife outside for a walk and stay with the baby on his own. This treats colic for the whole family very well. Thank you.
Здравствуйте, доктор. У меня такой
Hello,
вопрос.
doctor. I have a question.
Помогает ли действительно
Does rocking the baby help when he or she is colicky?
Вы знаете, очень много.
You know, a lot of people, a lot of mothers observe that carrying the baby in their arms
Он на какое-то
calms
время
him or her down after some time.
Вот что очень важно.
It is very important.
Если это
If it doesn't
не
help,
помогает,
You need to stop doing it.
вот я хочу, чтобы
I
вы...
want you to keep that in mind.
Когда вы
It's
носите
thus
ребенка на руках
when you
3 часа,
carry,
но несмотря
when you've
на
been
это,
carrying your
он
baby
3
in
часа
your arms for
орёт,
3 hours,
да, то
and he or she has been crying for 3 hours, you need to stop doing that and consider a different solution.
что обычно, если ребенок
Another thing is that if your baby calms down in your arms, it's not colic.
Понимаете? Вот особенность колик.
Colic has such a peculiarity.
Что если он
If your baby starts to scream, he or she will be doing it for 2 or 3 hours, no matter what you do.
Что бы вы ни делали. Если же он...
If he or she screams and you take him in your arms and the baby stops, it's not colic.
Кто кого? Это
This is a tug-of-war situation.
хочет быть на руках.
This is character. The baby wants to be carried in your arms.
Ему страшно.
He or she might be hungry,
Может, ему жарко.
thirsty. The baby might be scared, cold, hot, or maybe he or she wants to smell his dear mommy. This is all possible. It's normal, and there is nothing bad about it. Another thing is it has nothing to do with colic. Thank you.
Доброе утро. Скажите,
Good morning.
пожалуйста, при коликах,
Could you please
если
tell me
ребенка
if you put a colicky baby on his or her stomach, will the baby feel better?
Ну, давайте вот к этой теме сна на животе всегда очень
We'll come back to this topic, sleep on the stomach, very often.
часто. Сон на
But sleep on the stomach is something that medical science does not recommend at all. It doesn't at all.
в принципе, да? То есть потому, что есть такое...
And I don't recommend it because there is a finding called sudden infant death syndrome, SIDS.
Такое явление
This is found in all countries of the
во
world.
всех странах.
SIDS is an absolutely healthy baby is put to sleep to never wake up.
Укладывается спать и не просыпается.
Medical science doesn't know why it happens.
Почему это происходит? Но
However, it's proven that SIDS probability is higher if the baby sleeps on his or her stomach.
во время сна на животе. Поэтому все-таки...
That's why I strictly forbid the practice of sleeping on the stomach for colic relief.
С коликами я однозначно и категорически не советую. Понятно, да?
The main thing you need to understand is that there are factors that increase the screaming probability, namely overfeeding and overheating.
Вероятность криков.
If your baby is screaming,
Перекорм, перегрев.
do what you're supposed to do.
Сделайте то, что зависит от вас. Не надо проводить опасные для жизни
Don't
эксперименты.
conduct dangerous experiments, but do what you're supposed to do. Moisturize the air in the room.
Кормите по аппетиту.
Walk, feed to the appetite.
То думайте,
So when your baby is crying, keep in mind that your baby may be crying not because he or she is hungry, but because he or she is thirsty, or misses his or her mommy, or his diaper is full, and it's time to change it.
а не только еда.
A baby can have a lot of reasons for crying, but it's not just food. And the more you feed the baby, the louder and stronger he or she will be screaming. It's a vicious circle.
Евгений Олегович, ну, может, тогда...
Dr. Komarovskiy, can you reveal your secret? Why did your son's boys have no colic?
Наверное, потому что были
Well, I believe
введены вот
we
эти
excluded
самые
all the
причины,
causes for
что у
stomachache.
детей болят животы. Никто не кормил их каждый
Nobody
день.
fed them at
Они
night.
спали спокойно
They slept
по
in a
ночам.
clean, cool, moisturized room.
Они
They were
купались,
bathed,
немного
had lots of
гуляли,
walks,
занимались
so the babies were taken care of. That's why they weren't among those 30% of babies who suffer from colic.
есть. Поэтому еще раз вот я...
Once more, I'd like to point out that I'm not speaking about medicine for colic because I'm mean,
Колик не из вредности. Ну,
but
просто
because they simply don't
и
exist.
пообещаю, что как только...
I promise, as soon as medical science finds a cure for colic,
при коликах помогает, Мы
We will shoot a program and tell every mother about these magical drops that help for colic.
волшебные капельки, которые при коликах помогают. Пока их
As of
нет.
yet, they don't
Вы
exist.
должны понимать,
That's why we need to understand that colic,
повторяю,
I repeat,
нормальное
colic is a
явление,
regular thing for babies,
явление, которое требует
which doesn't require any fuss or medicine,
и лекарств,
but patience and love.
терпения и любви. И не только
And not only for the baby, but for the father as well. Is that clear? Great. I hope you've come to the right conclusion, and colic is not such a terrible thing. See you in a week. Good luck to you all.
Он был в животике у мамы, он привык к тепле. А его надо очень сильно тепло одевать, чтобы было как у мамы в животике. Но там есть еще такая пищевая линия, которая ведет к соединению. Эту линию, когда отрывают, тогда ребенок нервничает очень сильно. И ему надо эту пищевую косточку отрывать, потому что будет потом очень сильно прицеплен там к маме очень сильно. И будет вообще несвободный ребенок, если не отцепить эту пищевую косточку. Там надо завязать обязательно. Когда завязываешь, ребенок чувствует себя не так уж хорошо, потому что там же эта пищевая линия ведет к животу ребенка, и потом являются колики.